Hi, Tam here. So many things to talk about. I'm in hospital. This is the resource room, and it's 3:25 in the morning. But it's quiet now. I just saw my last patient, so hopefully I'm gonna get 10 minutes before the next patient. Sometimes at work, in your working environment, you're surrounded by people with no vision and no desire to improve, right? And when you step in as the new guy, right, you just got a new job at this particular place of work, hospital in my case, or anywhere else. Not this hospital is nice, but I'm referring to some other place I worked at in the past, right? So you might arrive there with this new mentality, this new philosophy, this new working ethics that your colleagues might have never seen before. And so you will encounter a lot of resistance. That's true. It might have happened to you before. You come to this new place of work, it's your first week at work, your first day maybe, and people start criticizing your work intensity, your work ethics. You want things to be done just a little bit better. You want things to be done perfectly if possible. And people will tell you, your colleagues, fellow doctors, or perhaps nurses are going to tell you, oh yeah, but here we do things like that. That's how we've been doing things for the last 10 years here. That's how all our doctors are doing things. And you tell them, yeah, well, that made sense 10 years ago in 2007. But now, in 2017, with the new literature, we now know that things work better if done this way. The typical example is that I went to this other hospital the other day, right? And basically my work, I work in trauma units and emergency units, right? But I work as a locum tenens, a contractor, So that means I'm not employed by a specific hospital. You could consider me a mercenary, lending my services to the highest bidder. So I jump from hospital to hospital, and I work when I choose to work, basically, right? And with that, well, the good things with that is that I choose when I want to work. I choose my house. I choose the hospitals where I want to work. But the flip side of that, the negative side of that, is that wherever I go, I'm never the permanent guy. And it's very difficult to change the mentality of people when you're not permanently employed in a specific workplace, right? So I'll give you an example. I went to this other emergency unit the other day. This patient was having signs and symptoms of an acute coronary syndrome. And to keep it simple, basically, the patient was having an impending heart attack. So right there, when it comes to nitrates, right, the recommendations, the ACLS recommendations, right, advanced cardiac life supports, are that TNT, nitroglycerin, is the preferred nitrate in a patient having an acute coronary syndrome or an impending heart attack. That has been proven through multiple studies all over the world. Nitroglycerin is the preferred nitrate. It's short-acting, it works, and that has been proven. If the patient is not hypotensive, if the patient is not on Viagra or Cialis, if the patient does not have an inferior MI, the nitrate you give is TNT, nitroglycerin, right? Now, I ask for nitrates, and this nurse brings me isodiol, right? And I said, no, isodiol is not good enough. Let's give some nitroglycerin, either a tablet or some spray sublingual. And then she goes on, or they go on to say, no, in this hospital, we use Isodial, that's fine. I said, no, that's not fine. Isodial is longer acting than nitroglycerin, So let's give a short acting nitrates, and that's TNT, right? Nitroglycerin. No, but in this hospital, that's what we do, and it's always been working. I said, listen, I don't want to teach you, the pharmacology of nitroglycerin versus Isodial. Now we've got this patient, he's not doing well. Give me what I need. And then, they finally gave the nitroglycerin spray. And that got me thinking, just because you've been working with doctors who've been given Isodial or maybe ordering Isodial, doesn't mean that's correct. But when you keep doing that, when you keep changing things, very, very soon, you will be labeled as the difficult one. This doctor is so difficult to work with. This engineer is so difficult to work with, right? This accountant is so difficult, And often, in any kind of job you do, whether corporate or medical or any job you're doing, often it's those who are pushing for perfection, who are pushing for improvement, who ultimately will be labeled as the difficult ones. And if management is not open to suggestions and improvements, those difficult human beings are often the ones that are going to get fired. That's unfortunate. But that's the truth. And if they're not fired, often they will resign. And I've worked with many doctors over the years, excellent top doctors, who just resigned and said, I'm never going to come back to this particular hospital or that particular hospital because, they just couldn't take it anymore. And I've done the same myself. I had to resign from certain places of work because, people were so reluctant to change. They were so resistant to changes, And that's sad. But my advice to you, if you are in a situation like that, is to never compromise your standard to fit in, right? You are an eagle and you're flying in the sky and soaring like an eagle, empowering yourself with knowledge, academics, ethics, and discipline. Don't lower your standard to fit in. Just so that you don't stand out and they won't point you out as the difficult one. So yeah, that's my story, man. Don't compromise your standard for the sake of fitting in, so that people don't say you're difficult. No, if you're in a situation like that and you feel trapped because your hands are tied and your wings are clipped and you can't fly like you're supposed to fly, resign. Better be happier in another environment that pays less, but where you can truly fly and emancipate yourself and develop yourself, than take a crap load of money somewhere where business ethic is not followed and business practice is dodgy, to say the least. Sometimes people ask me, hey man, in your previous job, you used to make so much money. And now, you're making less money. It doesn't make sense. Why don't you go back to that hospital, or to that place of work, or to this? And I tell them, it's not about the money. It's about inner happiness, I think, You want to be at peace with yourself. When I sleep at night, I'm at total peace with myself because I know that I'm doing the best I can every single day for my patients. Right? Every patient I see, in my mind, I'm not exactly seeing that patient. I'm seeing myself, a reflection of myself, lying on this resusc bed unconscious. It is myself that needs to be helped. So I'm helping myself, in fact, you know, with every patient that I treat. I imagine that woman to be my mother, my sister, you know. I imagine that man to be my brother, you know, to be myself, to be my father. I imagine this kid to be my kid. And I want to do the best that I can for them. And I think this is how we should all be, you know. So yeah, that's my message to you today. Don't compromise. Don't care about being called, being labeled, being difficult. Who cares? I'm not difficult. You're difficult to work with. No. You are finding it difficult to work with somebody who's functioning at a higher level than you. Turkeys and eagles. A turkey will never ever be able to fly like an eagle, right? So the people who work with you, the people around you, if they call you difficult, take it as a compliment. You know, you're not being difficult, but you are forcing them to be at the top of their game. And not make mistakes and drop the ball, man. I mean, especially in medicine, you know, especially in trauma units and emergency units. Complacency is not allowed. You can't just drop the ball on the field. You're gonna lose your patient, man. So of course, you have to be disciplined, and of course you have to do everything according to what is ordered. And those who cannot keep up, they must do themselves a favor and resign and do something else or move on to something else. All right. That's it. I hope this helps. Remember, as always, keep on improving yourself and be better every single day. Cheers.